So Robert, when it comes to patient communication, can you explain how that plays into dental malpractice?
Sure. Patient communication or ineffective patient communication is one of the largest contributing factors to malpractice claims. So, our dental data claim base shows that 12% of all of our claims are directly attributable to some failure in quality communication, and 13% of our dollars paid out fall into that category. So, the thing is that it's a rather simple correlation. I mean, patients tend not to sue doctors that they communicate well with. And so the better established communication, the higher the quality of patient communication in your practice, the better clinical outcomes and the lesser chance for a patient injury and subsequent malpractice claim. So even though it's something that's not directly related to clinical practice, I mean, as we're talking about a communication tact here, it has a huge and profound impact on the clinical outcomes that your patients experience. And also as important, it involves the entire team. It's not just the dentist in this scenario. Your front office staff is the first person to see your patient and the last person to see your patient. And so making sure that your clinical and non-clinical staff are aware of just how important good, solid patient communication is to the entire practice.
When it gets to quality communication, what is, the importance and the benefits of that? Can you expand on that?
Yeah, so from a clinical standpoint, the clinical importance is if you communicate better with your patients, you're starting out with better clinical information. I mean, just use for example the history and physical. Going through the history and physical with a patient or talking with them about the reason they presented to your practice. If you're able to communicate with them better, if they're communicating with you well, you're starting off with better information. And so clinically, you're able to do your job better if you have solid clinical information. Patients tend to adhere to their care plans better. They tend to be more involved in their own dental care. They tend to follow through on care plans. They tend to follow through on dental hygiene at home if you communicate better with them. So the more effective the communication, the better the clinical outcomes that we see on the backside of your care. So some of the benefits of solid communication: you've got a patient who's more engaged, patients who are more involved in their care plan and in helping to establish that care plan. Patients tend to be more willing to ask questions if we've got good communication. They tend to adhere to treatment plans better. They tend to be more satisfied with the care that they're receiving from your practice when they're involved and the communication is solid. We see that there's lower cost and improved efficacy of the care when you have good, solid communication with your patients. And then increased trust and loyalty. So we know that all of these things lead to better clinical outcomes. And again, the eventual goal here is better clinical outcomes, less potential for a patient injury, virtually eliminates the possibility for a dental malpractice claim if you have all of these things in place.
So how does a dentist go about establishing good patient communication within their practice?
Sure. So we have a 3-step approach to establishing quality communication. And let me start by saying, at this point in time, the quality of your communication is becoming more and more important because you're seeing a different patient. So the patient you're seeing today isn't a patient that you were seeing just a few short years ago. You've got patients who are more prepared through research or think that they're more prepared through research. They tend to be more clinically savvy. They tend to be more critical of decisions that you make. They tend to be more challenging of your clinical opinions. And they tend to be more consumer than patient. They're making purchase decisions as opposed to forming doctor-patient relationships. So we start off with a difficult patient. We want to make the communication process as simple as we can. That's how we get to the 3-step approach. So building rapport and setting the tone is step number 1. Eliciting patient concerns is step number 2. And then setting the agenda for the treatment plan is step number 3. So as far as building rapport and setting the tone, I look at this as the basic foundations of customer service. You can't get to quality communication if you don't have the basic foundation set. And these are the simple things in a practice that should be happening with every single patient, but that when you're tired and when you've had difficult patients throughout the day, these tend to be the very first things that go out the window. So I want our insured dentists to think about setting that foundation in customer service in order to build towards solid communication. So I'm talking about the simple things. Be prepared when you walk through the door. Know what the treatment history is with your patient. Greet the patient. Make eye contact. Shake hands. Introduce yourself. Smile and be pleasant. These are the basics, like I said. Sit down with your patients. Chairside manner makes a difference. The patient's perception of how long you spend with them significantly increases if you sit down when you're conversing with them. Use the patient's name. Again, simple things that make a difference. Attend to the patient's comfort. Acknowledge the wait. One of the largest complaints we have from patients about dental practice is wait times. And we find so often that it's not the wait, but that it wasn't acknowledged. Simply by saying to a patient, we have been swamped today, and I'm sorry that you had to wait for 25 minutes in the waiting room. That diffuses that scenario, that wait time immediately. It lets the patient know that you're concerned about their time. And can diffuse a situation where a patient is angry from having to sit out in your waiting room. Just acknowledging that wait. Convey a knowledge of the patient's history. This is a big one, the utilization of personal chart notes. My dentist does this, so I come in to see my dentist, and while he was gloving in, he asked me a couple of questions. So what's going on in your world? What are you doing? And, so I told him that when I left there that day, I was picking up the kids and we were going to Florida to the beach for a week. So when I come back in, 7 months later to see him for my next appointment, the very first thing that he says, how was that trip to the beach with your kids? And I know what he's doing. You know what he's doing. I mean, he has a full patient population, but he made a little tiny personal chart note about the fact that I was going on a vacation to Reddington Shores, Florida. And then when I come back in, he looks at that in the chart, going back to being prepared when you walk in the room. And he comes in and mentions that, and I feel like I'm one of 6 patients in his practice. So that establishes that foundation for a good relationship and therefore opens the door to allow us to communicate better. So the next step is eliciting patient concerns, asking with a beginner's mind. And this is when you're talking to the patient right up front. We're trying to find out why they're here. We're trying to get their side of the story. And so we use the acronym ILS. I for invite, like saying to the patient, what can we address today? What can we help you with? L is for listening with quiet curiosity, allowing your patient to talk. And then S is for summarizing and checking, basically saying, so this tooth pain started a week ago and it's worse when you drink cold liquids. Now of these 3, I, L, and S, L is the most important far and away, listening with quiet curiosity. In healthcare in general, we don't allow our patients to talk. Yeah. There have been studies going all the way back to 1984, the Beckman and Frankel studies, where they were trying to find out how long on average a doctor allows a patient to talk before they interrupt them. And the results of these studies were staggering. On average, a patient is allowed to talk somewhere between 18 and 23 seconds before they're interrupted. And what we know is that when that interruption comes from the doctor, first of all, you're not getting good clinical information from the patient. Secondly, you're changing the dynamic of the conversation. When we're first talking with a patient and establishing the reason that the patient's there, we want that to be a patient-driven conversation. Mm-hmm. When you interrupt early in the conversation, the perception of the patient is, my job is to be quiet and answer yes or no questions, and this is a doctor-driven conversation. That's not what we want. We want the opposite. We want the patient to be the driver behind it. So one of the most important things as a takeaway from the patient communication program is to allow your patients to talk. In the Beckman and Frankel studies, they asked 30% of the doctors to allow the patient to talk uninterrupted until they've said everything they have to say. And on average, those patients talked for less than 2 minutes. Mm-hmm. And so my point here is that for about 1 minute and 30 seconds of extra time, allowing your patients to talk, you get a number of things. You get better clinical information. Mm-hmm. You get help in the diagnosis. Patients don't get to the good stuff first. You get a patient that feels like they got their money's worth and that their participation in their dental care is wanted and needed. So it also allows you to correctly prioritize the patient's issues. Mm-hmm. If the patient gives you 3 or 4 things that are wrong, if you allow them to talk and get all of those out, you're able to determine what is the most important and what should be addressed in what order. Mm-hmm. So what we find is that simply by allowing your patient to talk, you are much more efficient even though it costs you an extra minute and a half up front. So one of the things that I would ask you to take away from the program today, the most important part, would be to allow your patients to talk. And then the third part of establishing good quality communication is setting the agenda. So basically, this is a list. We want you to start with the diagnosis and educate the patient on the diagnosis, explain the recommended procedures, offer an explanation and a rationale for why this is the appropriate treatment plan, go over the treatment plan step by step, ask the patient to repeat in his or her own words the proposed treatment plan. We call this the teach-back method. And then provide written educational materials for the patient to take home and look at at home. So this is establishing that agenda so that we know that we have finished that communication line of steps 1, 2, and 3, and allows us to provide that solid communication, which leads to solid clinical outcomes.
Can you talk to us a little bit more about, the teach-back method, health literacy, and just plain language when it comes to improving patient communication?
Sure. 3 very important approaches to improving communication. So the teach-back method, this is used in healthcare a lot. What we want you to do to make sure that your patient is truly understanding what you're talking to them about is ask them to tell back to you what they just heard. If I talk to you about an agenda, about a treatment agenda that we've established, and then I say, do you understand? It's very easy for you to say, yes, I understand. Much more difficult, and I get a much better understanding of just how well you understand when I say, I want to make sure that I did a good job of explaining this to you. Tell me what I told you. Tell me what you heard. What is your condition? What do you need to know, and why do you need to know it? If you approach your patients like that, you'll get a much better understanding if they understand what you're trying to communicate to them. So the teach-back method has been used in healthcare for a number of years. We don't see as much use of it in dentistry. I think that it will give our insured dentist a much better understanding of how well their patients are tracking with what they're trying to communicate to them. So health literacy, another way of trying to understand how well our patients actually understand, and some of the things that we can do to improve that. Speak slowly and clearly. Focus on and repeat the need to know aspects of the treatment plan or take homes. Avoid clinical jargon. We do this in dentistry all too often. We talk technical. Talk more on layman's terms. It isn't going to hurt for your patients to understand exactly what you're trying to get across to them. Use illustrations. We've talked about this in the past. Animation and illustrations. The visual learner goes a long way as far as establishing quality communication just by using those visual aids. Use plain language educational materials. Encourage interactive dialogue. Let's make it a discussion as opposed to the doctor just talking at the patient. We talked about the teach-back method just now. Utilize that. And then provide treatment and follow-up care instructions verbally and in writing. Again, I think it's a good idea for patients to be able to have something to take home, to refer back to, and kind of to continue that learning and continuing that ability to improve their understanding and thereby improving the quality of the communication. Plain language, pretty simple. Use a font size of 12 to 14 points. Avoid excessive use of italics, all caps, underlining. Limit information to no more than 3 or 4 key points. Put the most important information first. Avoid lengthy lists, like the one I'm going through right now. Use simple 1 or 2 syllable words when possible. And then again, eliminate that clinical jargon. So these are things that are fairly simple, but a quick reminder of them will help doctors, establish and further that communication with their patients.